and gentlemen and everything in between, hello, welcome to the channel. I have acne cream on my face. Whatever. Okay, so I wanted to film today because usually filming puts me in a better mood and talking to you guys kind of like ups my spirit. Usually I'm a happy person, but right now I'm a bit irritated. Let me tell you what's going on real quick just before we get into the video. Well, so as you guys know, I'm starting nursing school this month and I have orientation in a few days. And the drive from my school to my home is a bit far, so I said, hey, I'm gonna get an apartment. And I've been saving all my money all summer, so I'm good there. But tell me why they're saying that I have to pay rent on the 1st, which is tomorrow, but I can't officially move in until the 17th. Y'all are, a majority of my viewers on this channel anyway, are adults, so y'all have life and experience. Is this something you've had to deal with? I just feel like that doesn't make any sense and it's really unfair to have people pay on the 1st, but they can't even move in until the end of the month. I'm paying an entire month of rent, but not even living there half the month. That's how it is, I guess, though, at least in America. Let me not even go there. Anyways, today we'll be reacting to the healthcare system of the United Kingdom. Again, this is in accordance of me about to start nursing school or possibly working for the NHS at one point. I have said I want to do travel nursing. I don't know if that is international yet or just local within the United States. We'll see when we get there, but it's definitely on my radar. So I want to learn as much as I can about the NHS and the healthcare system in the UK, and also just how we could better the American system, or how I, as a nurse in the future, the coming future, would be able to kind of help my clients, my patients, and apply things that y'all have over here. So yeah, subscribe if you're new here, like the video, and I'm excited to get into it. And I'm wearing this shirt very unironically. Yeah. Like the video too, buddies. Here we go. Buddies. Since when do I call y'all that? Ugh. Let's do it. NHS.
Every day, millions of people get great care from committed staff working in England's health and care system.
First, right off the bat, I can already notice something that we're different in than y'all. You got, first of all, a bunch of different colors, so I'm sure there's not demographics that receive more care than others or aren't able to get care in their communities. And also the age. You got the old man, you don't have an old woman, but I'm sure representation, she could be here too. With Medicare over here, I didn't even qualify for it when I applied. For nursing school, you have to have health insurance, so I'm still scrambling trying to find an affordable healthcare plan that I can sign up for, whereas in the UK, I'm sure, bitch, it would have been free. If only I was born in England or Scotland, my finances would be so much more at ease, but it is what it is.
But over the years, our needs have become more complex, and our services must adapt to tackle them. 1 in 3 people admitted to hospital has 5 or more conditions compared to 1 in 10 a decade ago.
Ooh, so she just basically said health is, even though it's healthcare and it's free, health in general is going down for the younger generation of today in comparison to the ones who were always at war. That's a crazy statistic.
As a nation, we are getting older, and more people need help living with a range of conditions rather than simply needing one-off treatment. There are 500,000 more people over 75 than in 2010.
Baby boomers. As we all know, World War I, World War II, all that kind of stuff. Everybody was going off to war, coming back, everybody was getting their freak on, which resulted in an influx in the populations. So now all those people who came back from war and had offspring, all those people are now getting older. And with age comes so many different health problems. You can break a bone easier, your skin gets more pliable. I don't know if that's the correct word to use, but just your eyesight goes down, everything. And from your teeth to your dentures to your needing a cane to your walking equipment, the elderly just need more. And if you have more population of elderly people, obviously everything's going to rise. But again, it's free, so it's okay.
And there'll be 2 million more in 10 years' time.
No, we're not out here having babies like that. Like the baby boomers? I don't think so. I feel like my generation, and I say my generation because I assume most of y'all are at least 30 plus. My generation is we're more selfish, for sure. So I don't see the population, at least in America, skyrocketing to this much incline. 500K to 2 million, buddy, in 10 years. And I don't even know what I'm eating for dinner tomorrow. I don't even know what I'm eating dinner tonight. How am I have kids? Yeah, I don't know.
Hospital is not always best for an older person. An 80-year-old can age 10 years in 10 days through lost muscle strength. Yet many people needing general care at home find themselves staying in hospital, despite not needing intensive medical attention.
Dang.
We also need to adapt to changing needs amongst young people.
This may come off a bit harsh, but they just said that people don't necessarily need the care or stuck there getting the care. So again, who's paying for all that wasted health care? Because, like, again, you have to operate the machines, there's things plugged up, there's electricity, and it's all being utilized for someone who's not necessarily in need of all those things in the room. So who would pay for that? Or is it just like, it's nothing in life is free, so, and y'all aren't the ones paying for it, so who has to pay for all this stuff? Ooh. I did hear, like, you only go to, like, the what's the word? The intensive care from the NHS if it's, like, a dire need. But, like, if you have a bloody nose, yeah, they'll see you, but they're not going to put you up in the hospital like this. So I don't think it's common, I guess. Y'all let me know. You obviously know more than I do in the situation. But for people who don't actually need the care to just be sitting up there, I feel like it's kind of a waste of resources.
We also need to adapt to changing needs amongst young people. 1 in 10 of our children suffer mental health problems, which can impact for life if not addressed early.
So mental health over in America is only something we just recently started to, like, start paying attention to. I feel like the more woke the world is getting and the more, like, aware of just our differences and understanding our differences and respecting our differences, I think that's going to help more with mental health. Like, there are certain things like insecurities and just things that now you can be more assured of with your differences. But to my understanding, also from what we've seen in, like, Educating Yorkshire and just y'all in my freaking comment section, y'all are tougher. The way you speak to each other, the way you joke around, like taking the piss, banter. It's more, whereas you can handle it, or students in your school are taught to handle it, if you did that over here, it would not fly the same way because it would be thought of as bullying or harassment or anything like that. So, like, I understand it because I kind of get y'all now, but in the beginning, yeah, even I was like, F you, when they would call me a wanker, whatever.
A fifth of children are obese by the time they leave primary school.
Having to wear school uniforms is assault. You're not going to change my mind on that. I would never want to, oh my god. A tie? Me in a tie. If you're a woman watching this video right now and on this channel and you had to wear a tie, let me know. Did you like it? I feel like that would just literally just getting strangled all day.
With diabetes already consuming around 10% of the health budget,
Dang.
This complex mix of problems across a wide range of ages cannot be solved by individual institutions alone.
Going off the diabetes, I think it's important for them to say which type of diabetes, because obviously we know there's one that's hereditary, but there's also one that's, like, based on your diet. Now, the ones that are just from... There is already... Again, I just get my information from my comment section, but there's already kind of like a tension between people who are slightly obese or overweight or whatever, and, like, their use of the NHS. It's not always their fault, you know, there's always some mental health issues going on there. Maybe it's hereditary, maybe they're big boned, or they just have binge eating habits or whatever's going on in the background. But how do y'all feel about the diabetics and overweight people using the NHS? Let me know.
So the NHS, local councils and others are joining forces to form health and care partnerships in every neighbourhood, town and area of England.
Nice.
The aim is to integrate care, making services more joined up.
I really love that though, because it's like literally every single... You can go 5 miles this way, 5 miles that way. You can get care everywhere, as well as hearing a different accent. Over here, like, I was trying to get my shots and my immunizations for nursing school. I had to go to Dallas County, which is like a 45-minute drive, and they didn't even have some of the stuff, so I had to go somewhere else. It was just like, it's a hassle. Ugh. And trying to do it the cheapest way possible is also a hassle, because I don't want to go to the hospital and, like, hey, I need the flu shot. Oh, well, bitch, you're gonna have to pay $1,000. No. Who are you trying to play? Not happening here.
And area of England. The aim is to integrate care, making services more joined up, improving care for people with incurable conditions. Preventative, anticipating illness and acting early.
For laying on your back for 5 minutes, guess what? You just had to pay $10,000. A 5-minute scan is at least $10,000. Never in my life. I'd tell the doctor to guess where it's at. Whatever the issue is, guess, and you go in there and fix it. $10,000 for nothing. Absolutely not.
Illness and acting early and personal, helping people take more control of their health. We want every individual to live healthily for as long as possible and to get high quality joined up care when needed.
What's it called? The GDP of England or the United Kingdom? The life expectancy. What's your life expectancy like? Like the oldest you people get. No offense, didn't mean to say you people, but you know what I'm trying to say. What's your life expectancy in England compared to America? Comment down below.
Right now, old divides between health and social care, physical and mental health, GPs and
they all
hospitals
work together.
Mean many experience disjointed services. By creating joined-up teams of doctors, nurses, therapists and care workers, we can better look after a person's whole needs.
It's like, it sounds like it's common sense, but at the same time, like, you don't actually... Because like I said, mental health wasn't even, like, considered a real thing in America until, like, recently. And especially, I feel like in the Black community, we don't take mental health or, like, that kind of thing like it's a legitimate issue going on. Like, if you're feeling sad about something, they'll just be like, toughen up, you know, get it together. Like, why are you crying about that? It's not that important. But if, like, for example, me, if I'm sitting here struggling about my rent, freaking people, how am I supposed to, like, sit here and be happy and, you know, whatever? I came here to get my mind off of that, yeah, but, like, am I as, like, joyful as I usually am on the channel? I don't know, maybe so, maybe not, but it's like when your mental health isn't there, you're physically not there, and that's just going to make you feel sick, and then it's all gonna fall apart. So I completely agree with this take that everything kind of needs to be tied together, whether it be physical health, mental health, or any of the other categories, social health. Like, it all really does tie together to make you 100% healthy.
And by working more closely with communities, we can help people to start life well, live well, and keep well.
Yeah.
To find out how your health and care system is working together, visit www.england.nhs.uk/integrated care.
Yeah, how are they working together in America? Bitch, they're not. Anyways, I hope you guys enjoyed the video. If you did, give it a like, subscribe if you're new here, let me know what other content you want on the Culture channel, and I'll see you in the next one. Bye!